Hello everyone and good evening. Welcome to this virtual event featuring the revamped RHA line of fillers. I am Dr. Lady Aranya Demandan, physician and owner of Concordia Star Medical and Aesthetics here in Puyallup, Washington. I will be performing a live demonstration, and after this there will be a question and answer, so stick around. At the end, I will let you know about the specials and a giveaway. So what are the advantages of the RHA line of fillers? The way it's manufactured is different than the other hyaluronic acid fillers in the market. It is made in a warm, constant temperature, allowing the hyaluronic acid to form naturally without cross-linking or adding other chemicals. This way, it can mimic our own tissues naturally, and it also can give longevity over time. I chose to bring on the RHA line of fillers to my practice because of its comprehensive portfolio. It has the RHA 2, 3, and 4. It is FDA approved for dynamic lines and wrinkles. However, besides lines and wrinkles, it can be used for pan-facial treatment, and it can be used in a variety of areas that are unique to patients' needs. The RHA line can treat a lot of aesthetic concerns. It's great for those with dynamic lines and wrinkles. It works well on the nasolabial folds, the marionette lines, the perioral area, and even the lips. It works also nicely to give volume to the lateral cheek as well as the mid-cheek, giving it a lovely lift. So the RHA fillers are great with animation and even at rest. So for someone who is wanting a nice filler that would work well for dynamic movement and at rest, the RHA filler delivers a natural result. So who is a good candidate for the RHA filler? I think everybody's a great candidate. It just provides you with a beautiful, natural, and long-lasting results. And it can be used for all skin types, all walks of life. I think it's just a beautiful line for everybody. Generally, the patient will see the results right away. Right after I inject, they see the difference between their before and after, and that's really a very exciting time. But sometimes with swelling, it takes about a week for this to settle. And after a week or two, I like my patients to come back for follow-up so that I can see that everything is beautiful and to their liking. Generally, it lasts 15 months, but it is patient dependent. Sometimes they need yearly maintenance, or sometimes they need a touch-up in a different area. But generally, it lasts about 15 months. I tell my patient that it's very important to keep the injected area clean and not wear any makeup for at least 24 hours. Patients should also avoid vigorous exercises within the first 24 to 48 hours, and to avoid anti-inflammatories like Advil, ibuprofen, Aleve, naproxen, aspirin, and even alcohol that will thin their blood and lead to more bruising. It is common to have some redness after injection, as well as some soreness, but there shouldn't be any pain. When they get home, I ask them to watch for any new rash that could be a sign of vascular compromise, and I give them my personal number so that they have access to me anytime post injection if they have any new unusual signs or symptoms. So we have here our lovely model, and today we're going to do a treatment. So I'd like you to tell me what concerns you.
Well, I have a big smile, and I love to smile, but I have lines because of that. So to have some volume to kind of make me look like I don't have those smile lines, and give me some fullness under my eyes, because I'm a very tired mom of two, and I would like to wake up and not look so tired. So just kind of being able to hide some lines here, and then, you know, bring some fullness up here to just kind of
give you a nice lift.
A lift and some glow, and just to make me feel younger. Refreshed, yes.
Yes, we can do that. So as I can see, you've lost some volume in the mid face, and that is going to be augmented with the RHA filler. So we're going to also treat the nasolabial folds, and also give you more of some volume around the cheek area. So I'll be mapping those, and then we're going to start treatment. Are you ready?
Yes, I am. I'm very excited.
So before we start, I'd like to mark the areas so I can map the regions that you've lost volume and where we're going to add the filler. So I can tell here that you do have a nice cheekbone, and we want to preserve that. But in the mid cheek area, this is the area that I would like to treat. And you mentioned about your nasolabial folds. We will also be doing a superficial treatment there. And down on the marionette lines, we're going to augment this area here with some fillers to give it a nice smooth transition to the whole face, and we'll do the same on the other side. So you also have some volume loss in the marionette lines, and I'm also going to fill this with some filler, and this will give you a nice flow with the rest of the areas that we're going to get treated.
Sounds good.
So I'm going to start with the RHA 4, and we're going to provide it deep so we can provide support. So I'm going to start with the cannula, and you'll feel a poke. This is just the introducer, and I'm just going to get the poke in the skin, give you that poke in the skin. And this will be the entrance to my cannula, which is a blunt needle. So you should just feel some pressure. So this is a good filler because you can use it in the different layers of the skin to give the desired effect that you're wanting. So I'm just spreading this so it would really mold nicely all over to give you that lifted, youthful appearance. This time I'm going to use the RHA 2, and I'm going to go a little superficial so we can efface the nasolabial fold. So I'm going to give you another poke here. 1, 2, 3, poke. So at this point, I'm just below the, just right on mid-dermis, because some of the facial nerve or facial arteries are a little bit deeper there. And the nice thing with RHA 2 is we can also do the fern technique so that we can take out the more folds that are in the epidermal area. Okay, this time I'm going to use the RHA tree to layer it to give you some nice contour on the cheek area. I'm gonna give you a poke here. 1, 2, 3, and poke. Okay. And here goes the cannula. I'm also going to use RHA 2. There's a deep area here that we call the tear trough. I'm going to try and efface that with the RHA 2. So 1, 2, 3, poke. Okay? Okay. So I'm going to use RHA 3 and we're going to fill out this deepened areas in the marionette region. Another poke. 1, 2, 3, and poke. Good job. So here we're providing a little bit of support so that the sad face look is not showing there. So I'm going to treat your tear trough this time, and you'll feel a poke. 1, 2, 3, poke. Are you ready?
Yes,
All
I can't wait. Oh my gosh. This is awesome.
How'd you like it?
It looks amazing. It looks so natural and like I used to look.
Yeah, refreshed.
Yeah, refreshed.
And young.
Yes.
And lifted, yeah. And
Yeah.
I like the way it kind of molds into this inner tissue. It's very natural looking. And you would really feel that it just gives you a more kind of rested, lifted, natural
I can't get over how natural it looks. So
looking effect. Yeah.
I love it. Thank you.
Oh, you're welcome. My pleasure.